All right, so Jennifer Wortham, I'm at the Human Flourishing Program at Harvard University. We're going to be posting this presentation so you can download it. It gives a little bit of my background. Essentially, I've been in public health practice for many, many years and kind of came back to academia the last 5 years to really do deep dives into trauma and mental health and flourishing. I joined the Human Flourishing Program, which I'm really excited about. I joined in 2020. The program was just about 4 years old, or less than 4 years old when I joined. And it's been a really great adventure for me. The focus of the program is to bridge the quantitative and qualitative sciences. So we have a lot of theologians and social kind of work types of people, philosophers, and then we have the hard science side, biostatisticians and epidemiologists. And so we try to bridge our work from these different perspectives so that we're attaching both. In 2022, we launched a global flourishing study. And it's a big study. I'm going to go into that a little bit next. It focused on adult 18 years and above at 23 countries and territories, considering what we call nationally representative sampling. So we've been working with Gallup. Gallup helped us with all the sampling methodologies. Over 200,000 participants in all six populated continents. And it's a 5-year study, so being a longitudinal study. We are now in the third year of data collection. And when we look at the totality of who we're representing, it represents about 64% of the world's population. So it's an exciting study, largest study of its kind. I am not responsible for this study. Tyler Vanderweel, who's the director of our program, and then Byron Johnson at Baylor are the ones who conspired and got together to launch this. They got a very large grant from Templeton. Most of the money went to Gallup for data collection, but it was $50 million plus that was allocated to the study for this. Right now, we're going the third year. So I want to talk a little bit about some of the concepts around human flourishing, and we call these like the pathways to flourishing and the domains of flourishing. So the domains of flourishing are family, work, education, and religious community, which is really your spiritual life. And then the pathways to flourishing involve what we call happiness and life satisfaction, physical and mental health, meaning and purpose, character and virtue, and close social relationships. So this is built on work that was initiated by Dr. Vanderweel. He published and presented at the National Academy of Sciences in 2017, this work. You can see all the little numbers are all the studies that it corresponds to in a very large scoping review that he did. And so this is kind of how our program is structured around these different domains and pathways. So when we look at so far early data collection, this is from the first year data, we see that flourishing tends to increase with age, but the patterns vary. They decrease in age in Poland and Tanzania, which is really interesting. The gender differences are small, but also varied. For example, somewhat higher for women in Japan and men in Brazil. It's higher among individuals. So when we talk about flourishing, we have about 40 questions that we ask on this survey. And so when we're looking at the key indicators of flourishing, that's where we kind of get this data from. Of course, it's higher among employed and self-employed individuals compared to unemployed. It increases with education, but there's an interesting reversal pattern in Australia and Hong Kong. And then higher for those attending religious services or other forms of community engagement. So those are some key demographic patterns in the United States. Doing a little deeper dive, we're concerned. There's young people in many countries that are not flourishing. We look at flourishing as a multidimensional and look at different countries and how they're flourishing in different ways. So in the developed nations, of course, they're high in financial security and life evaluation, but we tend to see lower scores around meaning, pro-sociality, and good relationships. So in the United States, we have higher financial security, but we have a kind of an epidemic of loneliness, which is really interesting. And then how can we carry out this economic development without compromising meaning, purpose, and relationship and character? That's a really important question now that we're posing, and we're working with our different scholars to try to tease that out. And then we talked earlier about religious service attendance or other community events, but it is strongly associated with well-being across all countries and across all outcomes. And when we look at, where the trends are with more individuals engaging or associating themselves as spiritual or humanists, how does the humanist and eudaimonic forms of well-being in economically advanced nations, we're looking at how is that impacting declines in religiosity. So that's another area we have people exploring now because of the results. We need to figure out what are the pathways of spiritual development or formation, and how does that, what are the pathways to well-being, and how does that impact flourishing? Okay, so next I'm going to go into barriers to human flourishing, because that's where I spent a lot of my time. I look at, I spent a lot of time with a working group called the Suffering and Adversity Working Group. And so when we look at barriers to flourishing, it seems kind of common sense. So exposure to chronic adversity and trauma certainly are impacting flourishing. Structural and economic inequities are impacting flourishing, especially in countries where they don't have access to safe food or housing, and where the quality of healthcare education is really poor. Social isolation and relational breakdown are also key barriers to flourishing. We look at cultural and institutional norms that really privilege a narrow few, so there's widening gaps. Chronic stress and environmental instability. So, of course, nations that are being impacted by climate change are having challenges with diversity. And then an area where I'm specializing and focusing most of my attention is the unaddressed spiritual and moral and existential distress that revolves around loss of meaning or hope, moral coherence, and a connection to something greater than oneself. These are often overlooked dimensions, but that's where I decided to spend my time. So that's what I'm doing most of my research on. So a big focus of my research is in an area called moral injury. And just to give you an example, I convened about 3 years ago a working group on moral injury. And then we had in 2022, in the summer, we had I would call it a research collaboration. We brought people together, a research retreat, and we developed what's called a consensus definition. And so there was a lot of different aspects and views of moral injury, and there was dozens of definitions that were floating around, and there were nuances, and I really wanted to bring people together. And so the result of that was this definition of what is moral injury. So moral injury is considered persistent distress that arises from a personal experience that excuse me, that disrupts or threatens somebody's sense of goodness or of oneself, of others, or institutions. Take a little drink here. Or what are understood to be higher powers. And so essentially, or really one's beliefs or intuitions about right and wrong and about good and evil. So it really focuses on the existential distress that people are experiencing. So this definition in our framework for moral injury is highlighted in a paper that was co-authored by Dr. Balgruel and myself, and it was published in Frontiers of Psychology. And actually, that date is wrong. It's 2025. So it got published this year. So a moral injury can occur when a person experiences, perpetrates, witnesses, or fails to prevent acts that are known as what we call potentially morally injurious events. And so these acts are things that transgress their moral beliefs, values, or ethics. And we're going to talk I'm going to go a little bit deeper in a few minutes on what that means. So it could have a spiritual dimension. It often does, especially when the individual is experiencing an existential crisis or a spiritual emergency resulting from exposure to a morally injurious event. So who experiences moral injury? Anybody can experience moral injury. And that's one of the things that we address in our consensus forum, is that it typically moral injury is looked at as something that somebody perpetrates. They violate their own morals or ethics, or that they witness, but they feel that they couldn't stop, but they witnessed it. And so they were kind of a passive participant because they didn't stop it. But my recommendation and view, and we did a lot of discourse around this, was that victims of moral injury also are suffering. And so at the time, we decided not to categorize them into different names. We just put it all into moral injury. But then we have this overarching framework on moral called moral trauma. And so all of these elements fall into that. And just before we leave this slide too, moral injury is also described in the literature as moral distress. So you'll often see that and they'll explain it or come across both ways. So it's frequently found in military personnel. That's where most of the research has been done with veterans. The moral injury was really first described by Jonathan Shea, who was working with veterans from Vietnam War who weren't getting better in spite of lots of different types of treatment. These individuals had many of them intractable PTSD, but he stepped back for the people that weren't getting better. He did a kind of a deep dive in their charts, and he found commonality that many of them had expressed that they had committed acts or been involved in acts that they felt weren't forgivable or couldn't be forgiven. And that's when he dug deep into some of the ancient literature around World War I, World War II, where people were experiencing kind of crises or suicidal thoughts around things that they had done or had seen. And he came up with the term of moral injury. And so since then, a lot has been written about it. We also see it happening, with law enforcement, police, firefighters, first responders, and then in healthcare workers, abuse survivors, and incarcerated individuals and more. So I was going to open this up a little bit to questions around the COVID pandemic. So the COVID pandemic actually saw a resurgence of studies on moral injury, and it really came into the public discourse. So I wanted to pose a question to the audience. Why do you think that was? Why do you think moral injury was coming out into the COVID pandemic? And I can't see everybody on my screen, so I'll let you call on people, Emma. If anybody wants to raise their hand.
I thought you wanted to do questions at the end, Jennifer. You
So
wanted.
this is an exercise.
Oh, okay.
Questions. So it's like when the question is, why did moral injury come up during the pandemic? What are the conditions that led to moral injury in the pandemic?
It's a great question. Thank you. Maybe people could raise their hand and you can call on them then if they want to
I
participate.
can't see everybody on my screen, but because I'm in.
I can't either. I can only
Okay.
see five of us.
Okay. All right. So Jessica,
Hi, can you hear me?
I can.
Okay, this is super interesting. This is just very brief, but something to do with vaccines and there being kind of new codes of what's right and wrong and being exposed to people who we may think are doing something wrong that's harming other people and dealing with that, I guess.
Yep. That is a good explanation. And also people who were forced to get vaccines who didn't want them. That was
Yeah.
something.
Yes.
Okay, Alexandra.
I would definitely echo what Jessica was just saying, but I'm really interested in your paper, actually. I'm seeing a lot of existential crisis in sort of late 20s, early 30s. They've fulfilled their end of the social bargain, so to speak. They've got the education. They've gone on to sort of progress through their education up to masters. They go and get a corporate job, and they just feel like the framework doesn't support them, that it's insincere. It's all about getting as much out of them as possible. It has an impact on their work. But the moral injury in the pandemic is a similar thing that I'm seeing with those clients. And that was that in the UK, we experienced a lot of what appeared to be hypocrisy in the frameworks and government. And that caused a huge amount of, just disgust and questioning, if our frameworks can't contain us and hold us and help support a functioning society. It just opened up a huge amount of questions about, well, are they really serving the community as they're meant to, the institutions and government that are there? Is that sort of possibly part of it?
Mm-hmm. Absolutely. Yeah. So we can have moral injury or moral distress against institutions. Absolutely. Absolutely. Deborah?
I would say my experience working in a hospital during COVID, it was very challenging to be obligated to provide care that wasn't whole. For example, family members weren't allowed to be with dying family members and birthing women, and we had to limit that. And to me, that's 90% of the care. So that was hard.
Exactly. That's why a lot of first responders struggled with moral injury. Saskia?
There were quite some demonstrations in the Netherlands about the COVID measurements, and there were lots of police forces that acted brutally, but there were many police officers that also felt pressured and bad about their acting.
Okay. Yeah, I agree. So a lot of variations on why COVID could cause that problem. And we can see these things flowing over beyond COVID. We have institutional betrayals, we have hypocrisy, we have inequities, a lot of things that really bother people and they struggle. And when you're in a large corporation and you have massive layoffs and people that are left behind that have survivor's guilt that are still working there. And so there's a lot of different ways moral injury can impact people. So thank you for sharing, everyone. Okay, so all right, so I wanted to chat a little bit about some of the research linking childhood abuse to moral injury. And so my hypothesis, my working hypothesis, I'm working on a paper now that's looking at kind of how moral injury is compounded throughout life. And so individuals that have had a lot of adversity in childhood, whether they're exposed to domestic violence or some other types of inequities, and they've suffered nutritional or housing insecurity because of it, or just having a parent or household member with a mental illness and seeing the stigmatization and the challenges they've experienced. A lot of challenges in childhood can ultimately be a predictor of moral injury later in life. There's a paper that looked at what we call path analysis that revealed ACEs significantly predicted adverse mental health symptoms in adulthood. And population focused on like public safety. So this was, they looked at police, and the effect was mediated by symptoms of moral injury and moderated by difficulties with emotional regulation. So, for those of you who aren't really familiar with that literature, adversity in childhood, and we call it developmental trauma, actually has a huge impact on people's ability to regulate their emotions. And also it has an impact on the prefrontal cortex, so that individuals get stuck, like they have a hard time reconciling and working through complex problems and complex ethical dilemmas. In a study conducted by the Canadian Armed Forces, looking at both active duty and veterans, that revealed also a significant relationship between childhood emotional abuse and the presence of moral injury in adulthood. So in that study specifically, emotional abuse during childhood was correlated with a total score on the MIES, and with its two subscales, perceived portrayal and perceived transgressions, and those were highly correlated. And they remain significant even when they controlled for age and gender. So we do see some correlations. There are very few studies that I've found on linking history, but I think it's an emerging field, and we're going to see more over the course of the next few years. So common symptoms, and I wanted to talk about also when we look, S&R is spiritual and religious problems, and I'm going to explain why that's important to look at now too. So moral problems or moral symptoms look a little different than religious or spiritual problem symptoms. So these tend to focus on guilt and shame and self-condemnation, betrayal, sense of betrayal, anger, struggles with forgiveness, a loss of meaning and purpose, a loss of faith, hopelessness, despair, anxiety, substance misuse, and self-harm. Excuse the typo. And then spiritual religious symptoms, feeling punished, feeling unloved by God or the divine, loss of trust in the divine or God, anger towards God or the divine, loss of faith, diminished connection with God or the divine or with one's spirituality or faith tradition, a loss of belief in one's divine purpose, and fearful of God's judgment. And so these symptoms can co-occur, or they can be individual. And if individuals are showing up with more of the symptoms under moral problems, there are assessments, the moral injury experience tool that I just mentioned, MIES. They can help you identify individuals that could be potentially having a moral injury challenge. And then again, you deal with a lot of people already in spiritual emergence with religious and spiritual problems, but it would be helpful for you to really understand, are these people really struggling with a moral injury that's causing them distress, the spiritual distress? So common clinical conditions that are associated with moral, religious, and spiritual problems: PTSD, generalized anxiety disorder, panic disorder, major depression, substance use disorders, suicidal ideation. You got both panic disorder, major depression, and anxiety, which are often common, also found in people that are diagnosed with borderline disorder or bipolar disorder. I have real opinions about borderline disorder diagnosis, but I won't articulate those today. Maybe that's for another call. But these are common symptoms common diagnosis that people have in the clinical setting. And I'm going to go a little further. Okay, so documenting moral, religious, and spiritual problems, disorders in the clinical record. So many of you are familiar with what's called the DSM. The DSM is published by the American Psychiatric Association. They publish a whole new version about every 10 years or so, but they have annual updates called TR, which is text revision. So they are the standardized criteria in the United States and in many other countries for diagnosing mental health disorders. The idea is that it provides consistency in diagnosis, treatment planning, research, and how people get reimbursed. It works in tandem in the United States with what we call ICD-10. Many other countries have ICD-10 as well. It's required for billing and reimbursement. And it includes a mechanism to address psychosocial contextual factors similar to religion, spirituality, and moral injury called Z codes. Why is this important? Well, I didn't put the whole history here, but one of the things that was the outgrowth of my work is that we put together a proposal to the APA to include moral problems in an existing Z code for spiritual problems and religious problems. And so now as of January of this year, there is an official Z code for moral, religious, and spiritual problems. And so you can categorize those. I'm going to explain how to do that in a few minutes. And so why is this important? Well, when you have the focus of clinical attention is a moral, religious, or spiritual problem, and this is the definitions that came out of it. So moral problems include experiences that disrupt one's understanding of right and wrong, or a sense of goodness of oneself, others, or institutions. So the APA adopted from our definition, they adopted a shortened version of this. Spiritual or religious problems include distressing experiences that involve loss of questioning of faith, problems associated with a new faith, or questioning of spiritual values. They may not necessarily be related to an organized church or religious institution. So if you identify any of these problems, then you should assign a Z code, the Z code, which I'm going to talk about in a minute, in the patient's chart. And the reason this is important is because even though the religious and spiritual Z code has existed since the 90s, it's hardly ever used. Most people don't know about Z codes and why they're important, but it does provide contextual information when there's not a formal DSM code, a diagnosis. And ultimately, if we want to have a diagnosis code around a spiritual, religious, or moral problem, we have to have data. And so without being assigned anything in the chart, we have no way of gathering data. We can just do studies, and the APA just doesn't factor that in. So this is kind of the pathway to getting ultimately a formal diagnosis, and that's why it was really important to do that. So Z codes allow clinicians to really document the context of suffering the patient is having, not just their symptoms, and to account for the whole person. So in a trauma-informed and spiritually integrated way. It serves as a framework for recognizing spiritual and moral distress in clinical practice. It helps clinicians document distress that's really not considered a psychiatric disorder, but impacts their functioning and care. So the benefits of capturing these Z codes really include opportunities for systematic screening, enhanced referral pathways, improving analytics, ultimately, we hope getting a full diagnosis and then reimbursement alignment. Right now, there's not what they call a modifier, or there's no additional reimbursement for moral, religious, or spiritual problems. That's our next step, is to get that updated. And it's hard. It's hard to get social determinants of health reimbursed at a higher level. Right now, the only way you get it is if somebody's homeless or has severe nutrition or malnutrition, then they can get it. But we're working on that next. Okay, so here's the code. So if you have a patient and you're trying to diagnose what's going on with them, or you want to add moral, religious, or spiritual context to their chart, you could document it with Z code 65.89. Okay, that's how you would do that. I'm not a reimbursement expert beyond this. We have had a couple of seminars, and we're going to have another one probably in early February on how to document and code moral injury. So Emma can make sure she gets for that information and can pass that along if you're interested in how to actually do a little bit more in-depth documentation work on this. So now I'm going to move into holistic care approaches. So holistic approach to care for people with moral injuries is really focused on moral injury, but it really applies to anybody with a moral, religious, or spiritual problem. I find it's important to look at it from multiple dimensions. And so many of them get psychological care, but many psychologists are uncomfortable addressing spiritual, religious issues. And many of you know that, which is why you're probably working as spiritual coaches or therapists, or spiritual emergence coaches or therapists. But it's very hard to get them to focus on it. So what I recommend in those cases is that we bring in pastoral or spiritual care support personnel. I would love it if every psychologist would grow those competencies, but many of them aren't interested, or they don't have time, or they don't understand the relevance. So it's important. They may need social services and support, peer support counselors, restorative justice practices. This is just kind of the beginning. A big part of holistic care for me is trauma-informed care, which I should have on here, but I was moving a lot of my slides around and I took that slide out, which really says that they need an approach to incorporating what I would call, exercise, nutrition, and meditation and mindfulness practices as well. I go through some of that in here. So when we look at pathways to healing for those with moral injury, self-care is, of course, very important. Psychoeducation is very important, because when they understand a little bit better, they can have a little bit more agency towards their care. So this particular one I was talking about, like child sexual abuse, is very important for them to understand all the different ways that's impacted their sense of being. And many people with moral, religious, spiritual problems have had some kind of sexual abuse history. Adaptive disclosure therapy is also very helpful. Support groups, because individuals can articulate what their challenges have been. Building supportive relationships, of course. Self-forgiveness and compassion are important. There's several different techniques, and I can go deeper into that in another session. Finding meaning and purpose is very helpful, in engaging activities that really help promote a sense of meaning, especially for people that have perpetrated moral injury. It helps give them a sense of meaning and purpose, and in a way kind of cleansing their own wounds and sorrows. Setting boundaries is very important for individuals to learn how to set boundaries. Positive self-image therapy or approaches. There's another process called Path to Reach Forgiveness, which is developed by a gentleman named Everett Worthington. So the Human Flourishing program is doing a lot of work. We actually have a global forgiveness initiative that we're launching, or we have launched, to really help disseminate the path to reach forgiveness. There's a workbook, and people can work on it on their own, or it can be facilitated in groups. So that's very helpful for people that have both experienced moral injury and have perpetrated moral injury as well. There's this restorative justice and reconciliation programs that can help. And then for people that have PTSD, rapid eye movement therapy. So most of you should be familiar with what that is. So there's different resources available to support that you can look into. So the field of positive psychology offers a lot of really good programs and services that could help fostering creating meaning and purpose and generating compassion and gratitude and promoting acts of kindness. But other resources which address ACEs and trauma, self-loathing, etc. So Harold Koenig has published on something called religious and spiritual cognitive processing therapy. I can get access to that if you're interested. That's 12 modules that address shame and guilt and forgiveness and many other aspects of moral injury in the individual's own faith traditions. So he has mapped 5 faith traditions, the 5 major faith traditions. And so that can be administered either by a therapist or a chaplain. And what they do is they go through the modules, specifically the ones that are focused on the struggles that the individual is dealing with. And it pulls religious text, and then they can have dialogue around that specific issue. And they have seen significant improvements in symptoms of PTSD and moral injury with that type of therapeutic approach. Addressing betrayal and resentment, so the Path to Forgiveness, Everett's program. There's actually a website on it, and he has lots of really great books. He's just a very thoughtful, very thoughtful person. He actually has lived experience. His mother was killed by a drunk driver, and so he comes from a place of really understanding of betrayal and the need to forgive. Of course, breathing and mindfulness practices, there's lots of sources there. Addressing sadness and mild depression. David Burns has a great book. Addressing anxiety. David Rosmarin wrote recently a book called Thriving with Anxiety. So these are just tools you could get to patients or use yourself. Enhancing self-esteem and agency. So BIA character strengths, a good friend of mine, Taya Rashid, is doing a lot of work in this area. This is something that was developed by Seligman and his team. It could be under the positive psychology aspect, but there's a lot of merit to looking at character strengths and promoting that kind of support as well. And so I'm working on introducing a platform for providing what I'm calling whole person flourishing, really focused on people with trauma. And so hopefully we'll have this out in the spring, and it's called Quest. And it encompasses, it's going to have lots of different self-help tools, and then tools that can augment people that are in therapy or coaching. And so the idea is to really improve engagement with therapies and have a good understanding of what's working and not working for people. So we'll get more information to Emma as that evolves. Hopefully that'll be out in the springtime.